In rural India, accessing specialized healthcare, especially this healthcare medical treatment, is extremely difficult. Patients often travel hundreds of kilometers just to consult a specialist doctor, leading to delayed diagnosis, missed follow ups, and increased mortality. Most of the digital healthcare platforms fail in villages because they depend heavily on stable internet, complex apps, and continuous connectivity. Medical records are paper based, prescriptions are easily misunderstood or altered, and there is no continuity of care. As a result, rural patients suffer not because treatment does not exist, but because access, trust, and connectivity are missing. Now, we here, the team xDEVS, are presenting the telemedicine portal for rural health support with AI driven healthcare support and blockchain based trust. Now, this is the user portal wherein the users can log in and get access to all the available doctors who have registered onto our platform and even book a consultation. Now, once the consultation is booked on, the request is then sent on to the doctor's portal and it will be visible on to the doctor's portal in their recent consultation request. And once a request is confirmed, an email is sent to the user and also on a notification onto their dashboard as well. Also, you can see that we are having a multilingual support, which is that the user can select any language, and we're providing that as an option over here as well. Now, getting on further on, it is very important in rural areas to make it possible for the users to be able to identify what medicines have been provided to them. Now, rural people aren't much literate and they aren't aware of what medicines are right, what are wrong. And for that purpose, we have implemented an AI model wherein the user simply needs to upload an image of their medicines, and thereon we provide detailed information about what the medicine is, the description, the dosage, the side effects, the warnings, and all the other conditions as well. The next thing is collecting medical records. Now, a big issue that exists is that once a patient goes to a specific doctor, he consults from that doctor. Maybe the next time he won't be going to the same doctor. And in this case, a major issue that exists is that the new doctor has no access to the previous historical data of the patient. And thus, collecting this data helps us to manage our portal way much better. Okay, this is an important step in that process. Now, basically, if I take this QR code from the patient, I go to the QR code analysis feature. I'll just upload the QR code over here. Okay, so as you can see, if I upload this QR, it's processing it right now. And in just the matter of few seconds, this doctor now gets access to the entire medical history of the patient. So I'll just go to view complete profile. Now this option basically provides all the medical history that is was filled in by the patient during the registration process, the different important medical records and reports that were uploaded or were accessed by the previous doctors is also available. And every time this happens, a QR code is scanned, it is also registered on the blockchain network. As you can see, the current transaction is being processed. Okay, as you can see, the transaction has been included and will be reflected in a short while. Yes, now this is a success. Basically, the transaction was registered and now it is a blockchain verifiable transaction. As you can see, it's blockchain verified now. And similarly, if I simply go on to the patient portal, I will refresh, and you can see that Dr. Jason just verified this QR code a few minutes ago and it is visible over here. It is blockchain confirmed and it can be also viewed on Etherscan. So we're making use of the Sepolia ATH testnet for blockchain implementation. The next part is the insurance plan. So as we know, SIPs are done in mutual funds, but we are implementing the same concept over here for insurance. Mediclaim policies exist already provided by the Indian government, and we are also promoting that. So as you can see, the government schemes that can be freely accessed by the rural people, that is something for medical that is already available. When it comes to insurance plan, we are providing them much accessible cheaper versions of insurance that can be set up by the rural people. This is a business model that we're following. Next part, if we go to the doctor's portal, an important feature that we have implemented is the prescription verification. So, by uploading a prescription, the doctor can actually verify whether a prescription is valid or not. And for this as well, we're making use of the blockchain technology. So, as you can see, I'll upload the PDF, it will get hashed, and then that hash is computed and compared with the blockchain network. If this exists precisely, it is verified. If there's even a slight change, it will be not verified, which actually, indicates or flags a danger that this prescription might be altered and can be faked as well. The next feature is the analysis details. Now, this is an important feature wherein the X-ray scans, the MRI scans, and different types of scans can be used to identify any anomalies. As you can see, this X-ray scan images was uploaded by the doctor. It helps the doctor first of all make use of the ML model that we have implemented and identify if there is any issue in this X-ray. So as you can see, using the YOLO V8 model, we have identified a tumor that exists. Now, definitely, this is not 100% accurate model. We definitely need some human intervention in this, and for that purpose, it requires the doctor's verification. It is just a method to make the process easier for the doctor. This is all the features that we have implemented. A lot of much more, but yeah, but in order to keep this video limited to be accessible to the judges, we have kept it short, and thus this is a portal. We are working on it. We loved presenting it over here, and a very big thank you.